It was really disappointing, actually. So I was actually a surgical resident at the time, and I was on the trauma service at the hospital here in Birmingham. And I think I can speak for every healthcare provider that in between February and March, where we were hearing and watching the news, and we were seeing patients coming in like nothing had changed, right? Meaning the same volume of patients, the same kind of patients, meaning indigent care, patients who were coming in off the streets that were homeless, people who were still of color, people who were white, didn't matter, right? So the population coming into the hospital didn't change dramatically. But what did change was that we were told that we didn't have enough personal protective equipment, right? So here we are, all panicked. We're like, okay, great. So is there a triage system? How are we going to screen people when they come through the door? Right. We had all these internal conversations. So to kind of allude to how Dr. Dunn talked about, like talking about the elephant in the room, this is the big elephant in the room, right? No one wanted to talk about like, well, how are we protecting ourselves and how are we protecting the patients that are coming through the door, right? If everything else is status quo. And it was a scary time. It was a lot of panic inside. We did end up finding PPE from all kinds of places. I mean, you saw how people were multi-purposing like ponchos, raincoats,
Wow.
things, umbrellas. I mean, people used whatever they could to try to help the situation and protect ourselves and help other people. It got to the point where we ran out of PPE and we didn't have enough PPE to protect ourselves, to the point where we actually designated areas of the hospital that could not handle and take COVID patients, just so that we could have a cohort that was separate, and people who did not have COVID could not run the risk of potentially getting COVID. Okay. And then it came so far as then we were saying, okay, we have run out that now we're going to take one of our satellite hospitals and we're going to designate that as the COVID-free hospital, which we all know, right? When you're in panic or when you want to get seen, right? No one's really following the rules, right? You have people calling in favors. Oh, my friend of mine got sick and, he needs to see an emergency medicine doctor ASAP, or has a surgical problem, so they run him through, right? Next thing you know, now you have these stragglers that don't realize that they have COVID. It's no fault of their own, right? The patient's not really at fault. The person coming in still needs help,
Hmm.
right? And then they end up inadvertently infecting other people, right? And so there's so many of us who have gotten COVID multiple times over as healthcare workers, right? And you can see this roller coaster ride where, Mayor Dunn is absolutely right. This idea of confidence and trust is so huge, and
Hmm.
it cannot be more overstated in that way. In that this is not a bandwagon. This isn't like coming to a concert, right? And did you get your tickets? Did you buy your tickets? Did you show up to the party? No, this isn't about that. This isn't about being part of the club. This is about saying, hey, well, we're all in this together, and there should not be this portioning, right? So another thing that happened in Alabama that was also really tragic for us as healthcare workers is there was this rationing and this idea of, okay, certain batches of people, whether they're healthcare professionals or they're nurses or they're doctors or they're people in the general public, were having to figure out when they were going to get access to their vaccine. So believe it or not, I got my vaccine at a community health clinic because, no joke, I got an email from my own hospital saying that they had a shortage and they didn't know when it was going to be available. So there were healthcare workers floating around, right? And as a trauma burn surgeon, I'm going to deal with emergencies, right? So this isn't elective, right? So you're just taking an entire workforce down if one person gets sick, let alone a whole department gets sick. And so I bring this up not to, bring shame, but to bring light on the idea that preparation is key and that trust is key. And if you can build that trust, then you can build a community that if you're scared, you have questions, you want to plan something, you know that you have somebody that you can go to. Right. And that's what I think we didn't have. So what we did is we had each other, and we all know what happens. You can have a community that comes together like we have so eloquently, so elegantly, right, come together and taking care of each other. But it's not a replacement for a system failure, right? It's not a replacement for that.